Hi everyone, my name is Pauline and I'm a Belgian nuclear medicine resident. In this video, I will discuss how radiotherapy works. Radiation therapy is a type of cancer treatment that uses radiation to treat cancer. I once had a patient who told me she had an infrared sauna at home and she asked me if it would benefit her treatment if she would use this on a daily basis. Unfortunately, I had to disappoint her. Infrared photons don't have enough energy to kill cancer cells. Let's explain this. There are different types of radiation. Infrared light is one type of radiation on the electromagnetic spectrum, just as the visible light that comes from a lamp in your house and the radio waves that come from a radio station. See, you know more about the electromagnetic spectrum than you think. Unfortunately, these types of radiation do not have enough energy to kill cancer cells. X-rays and gamma rays, on the other hand, have enough energy to break up molecules and damage living cells. Let's take a closer look at how radiation damages cells. Radiation therapy uses regulated doses of high-energy radiation targeted at genetic material within cancer cells. Damaging the genetic material inside cells makes them unable to divide and to grow, which ultimately leads to the death of cancer cells. This is what we call direct DNA damage. There is also indirect DNA damage. This is when radiation hits water molecules, the major constituent of a cell, to cause reactions that produce free radicals. Free radicals destroy almost everything they touch. In a very controlled form, immune cells use the same free radicals to kill things like bacteria and viruses. With radiation, there's absolutely no control. It is kind of like taking a tiny flamethrower onto all the internals of the cell. You may be wondering, how does radiation differentiate between cancer cells and healthy cells? Well, it doesn't. Both normal and cancer cells are equally affected by radiation. Damage to the normal cells is what causes these side effects. This is why radiation therapy is always a balance between destroying the cancer cells and minimizing damage to the normal cells. Luckily for us, normal cells heal better than cancer cells. And to minimize the injury to the normal cells, radiotherapy is split into a number of treatments called fractions that are given over several weeks. Fractions are usually given 5 days a week with the rest over the weekend. Delivering only a small fraction of the total radiation dose gives normal cells the time to repair themselves between the treatments. This also reduces the occurrence of unwanted side effects. Reactions to the radiation therapy often start during the second or the third week of treatment, and they may last for several weeks after the final treatment. The side effects can be divided into 3 groups. We have the site-specific side effects, we have the general side effects, and the late side effects. The site-specific side effects depend on the type and the location of radiation therapy. For example, radiation therapy to the scalp may cause hair loss. But people who have radiation therapy to other parts of their body do not usually lose their hair. The most common site-specific side effect is skin changes. The reaction is much like a sunburn and people may experience dryness, itching, blistering or peeling. Extreme fatigue is one of the most common general side effects of radiation therapy. Most people start to feel tired after a few weeks of radiation therapy, and it usually gets worse as treatment goes on. It goes away gradually after treatment has ended, but some people continue to feel tired for several weeks or months after radiation therapy. My supervisor used to emphasize and re-emphasize how miserable they will feel. But he also tells them that the only reason we put someone through such an experience is that dying from their cancer would be worse. And most of them will be trading a month or 2 of misery for the ability to live out the rest of their normal life. One possible late side effect is the development of a second cancer because of the original cancer treatment. The risk of this late effect is low, and the risk is often smaller than the benefit of treating the first cancer. So let's recap. Remember that radiation therapy is a type of cancer treatment that uses high doses of radiation to kill cancer cells and shrink tumors. Radiation therapy kills cancer cells that are dividing, but it also affects dividing cells of normal tissues. The damage to normal cells causes the side effects such as skin irritation. And fractionation is used to minimize those radiation side effects. Thank you so much for watching this video. If you liked it, please give it a thumbs up. It would really help me.